You say, doctor, that you prescribed a series of exercises? That is correct. And what do you call those exercises? Well, I call them orthetics. And orthetics are what? Orthetics are a systematic pursuit of straightening or correcting. It deals with exoskeletal devices to limit or assist motion of any given segment of the body. Doctor, is that different from orthetics or prosthetics? Yes, it deals with the addition or application of an artificial device to replace partially or totally missing extremities or organs. Doctor, what is thermotherapy? Thermotherapy is the treatment of disease using various forms of heat. And conduction? Conduction is heat transferred from a warmer object to a cooler one when both objects are in contact. Doctor, what is convection? Convection is the heat exchange between a surface and a fluid moving adjacent to the surface. And hydrocollator packs? Hydrocollator packs are local hot packs which employ silica gel as the heat-retaining agent. Is that different from paraffin packs? Yes, the paraffin packs are the use of hot paraffin for therapeutic purposes. Doctor, you mentioned several terms on your direct examination. Such as what? Oh, such as activities of daily living, a test which serves to outline and as accurately as possible how a patient functions in everyday life. Yes, in other words, how many daily activities he can perform in his own home and in connection with his work. Doctor, electrotesting is what? Electrotesting is the use of electrical currents to test the reaction of muscles and motor nerves. What does this include, doctor? This includes chronaxy, or the minimum time required for a current twice the strength of Riobase to elicit a muscle contraction. Doctor, is that different from electromyography? Yes, it is. And what is electromyography? Electromyography is the amplification and recording, both visually and audibly, of minute electrical potentials generated by muscle contractions. The electromyograms are valuable in the study of neuromuscular disorders. Doctor, is there a reaction of degeneration in this patient? Yes, the reaction of a muscle to galvanic, but not faradic, current. And what is Riobase? Riobase is the minimal intensity of the current required to elicit muscle contraction. Is it different from the strength duration curve, doctor? Yes, the graphic representation of current, strength, and duration required to elicit a minimal muscle contraction. Doctor, what is gait analysis? It is a method used to detect deviations in gait resulting from pain, weakness, incoordination, or deformities. And doctor, goniometry? Goniometry is the testing of the range of joint motion with the aid of a goniometer. What are muscle testing manuals? They are an important tool used to determine the extent and degree of muscle weakness resulting from disuse, injury, or disease. Doctor, the perceptual motor testing is a testing for what? It is a testing for perceptual motor skills, a response or family of responses in which receptor, effector, and feedback processes show a high degree of spatial and temporal organization. Doctor, finally, what is posture evaluation? It is simply the evaluating of the position in which various parts of the body are held while sitting, walking, and lying. Doctor, did you refer before to an angstrom unit? Yes, an angstrom unit in electricity. That is in alternating current, doctor? Yes, in alternating current, as well as an anode closing contraction. And these are activities, doctor, of daily living? Yes. And it is above the elbow as well as above the knee. What is an anode closing contraction? It is an Army Prosthetic Research Laboratory term used by the American Physical Therapy Association also. And is that the cathode closing contraction? Yes, a chronic obstructive pulmonary disease.
That was
Should
good.
shake out the arthritis in your fingers.